My doc, he tell me I got that Alzheimer some kind of disease, and that's a kind of bad disease sometimes, because you know I forget everything. I forget that who you are. Then I forget who you are, and then sometimes my doc say I'm dressing kind of sharp. How you think my dress look today?
Sweat.
Whoop, whoop. That's right. But see, my doc told me to enlighten you guys on these are some of the kind of things that happen when you get that Alzheimer or some kind of disease. Yes, that's what they say I have, but I don't believe it. That's what they tell me. But when you say you get that Alzheimer disease, they say sometimes you can't balance your checkbook no more. And you end up giving money away to people that should not want to get it. They tell me one time that somebody knocked on my door, and I didn't even know him, and he came to my door, and he asked me to fix my roof. And mind you, I just got my roof done, and he asked me to fix my roof, and I got my checkbook, and I gave the man $6,000 to come fix my roof. The doc, you know, when my kids got home, they were kind of upset with me. They said, "What you doing, Daddy? You gave that man $6,000, and you just got your roof done." Well, he said he wanted it. I thought I ought to give it to him. He looked like a nice man. You know, sometimes when you get that Alzheimer's disease, you do stuff like that. You know, sometimes I go in the bedroom and I get this smell, and I say, "What is that?" And somebody tell me, "You just wet on yourself." Well, that ain't too good, but that's what happens with that Alzheimer's disease sometimes. You know, so when you get that Alzheimer's disease and you got family members got that Alzheimer's disease, you got to be patient with them. Because they may ask you your name 5 times, and then 6 times they still don't remember. That's the kind of thing that happens with that Alzheimer's disease. You know, they say that 3% of the population at age 65 get Alzheimer's disease, and at age 75, 15 to 20% of the population get that Alzheimer's disease. Now look at this next number now. They say at 85 years old, which is a large part of our population now, they say you get 40 to 50% Alzheimer's disease. That's a mighty big number. So I say to all you all sitting out there today, you got to learn something about this Alzheimer's disease, because it's a bad disease. Like I used to drive all the time, and I kept winding up in the ditch. And they took my keys. That was a mighty bad day for me when they took my keys. And I couldn't drive no more. I was mighty sad. But I forgot pretty quickly because, you know, I got that Alzheimer's disease. So I didn't remember too long that they had took my keys. You know, sometimes when you get that Alzheimer's disease, you don't like to eat just right. You know, so they give me that food and they say, "Daddy, you got to eat this food." I said, "Daddy, don't want that food." They give me some other food. They say, "Daddy, you got to eat this food." Daddy said, "Daddy, I don't want that food. Give me an icicle or something like that." Or what they call a popsicle, icicle, some kind of sickle. Give me one of them kind of sickles that I like to have. And that's the kind of thing that happens when you get that Alzheimer's disease. Sometimes you don't want to eat. So I know everybody in this room knows somebody that got some Alzheimer's disease. Because when you say 85%, 55, 60, I forgot the number. 45% of the population going to have Alzheimer's disease after 85. I know somebody in this room knows somebody with Alzheimer's disease. It's a pretty bad disease. Now, don't get mistaken now, just because you get older, don't mean you got Alzheimer's disease. That don't mean that at all. When you get older, you might not think as fast as you used to think, but that don't give you Alzheimer's disease. When you get that Alzheimer's disease, you kind of forget stuff that you did this morning. Like I won't remember what they fed us at that breakfast out there. I think it was pig toes or something like that, wasn't it? Or maybe that was a year ago. I don't quite remember. But sometimes when you get that Alzheimer's, you can't remember what you had for breakfast. But I might remember your birthday. Because see, that long-term memory, that stays around a little bit longer. But the short-term memory, it goes quick. I just want all you all to know that this is real. This is real. Now, you got a benefit today because I normally only talk to my doc. "Hey, Doc, how'd I do?" "Okay, thanks, Doc." Doc told me I did pretty good with you guys. But, well, see, yeah, this is special now. "Doc, what'd you say?" The doc said that to make sure you tell them that they got to be mighty nice to those people with Alzheimer's disease and be mighty patient. Because sometimes they're going to get on your nerves. And Doc said, tell you one last thing. If any of you trying to take care of an Alzheimer patient by yourself, you can't do it. You got to get some help. That Alzheimer patient is real tough to take care of. And you end up with 2 patients. Okay? That second patient going to have depression, going to have stress, and going to have high blood pressure, blood, one of those 2. But so you just can't do it. So you got a loved one, a family member, trying to take care of that Alzheimer patient by themselves, you have to go get them some help. Because it just can't do it by itself. You know that? What you said, Doc? Doc said that's about all I should tell you guys.